The Ebola virus disease in Liberia has done a lot of damage to the social fabric of the community life of the people, because in the Liberian communities, people live community life. For example, children in the family will eat together in the same pen, and they will sleep together. Maybe 8 children will be sleeping in the same room, and people don't isolate themselves in the Liberian culture. But with the attack of the Ebola virus disease, everybody have to stay by themselves. People have to isolate themselves, and that has undermined people's love for one another, and it has brought in some kind of mistrust. People like to stay at a distance from each other, and that is affecting every other aspect of life in Liberia. And one of the things that has come out strongly in our campaign has been the fact that the women are the carers for the people who get sick in the family or in the community. So they are always the first line of attack for this Ebola virus disease. They are most at risk because they look after the children. And when somebody is sick in the family, it's the mother or the wife or the daughter who looks after them. And in the nursing profession, the nurses are mostly women, and they are the ones who the doctors would send to look after the sick people before even they can find out whether they are Ebola positive or negative or whatever. So this is having a great impact on the women, especially sometimes when the breadwinner dies. Then the women, if they survive, are left to look after the rest of the family. And one of the sicknesses is not a sickness per se, but pregnant women in the communities, whether even they're shooting guns or whatever, people are getting pregnant, and they are in the communities and in very remote areas. And these midwives or traditional birth attendants have to cater to these pregnant women, even when the nurses are on strike because they don't have PPE, when the hospitals are closed because there are no PPEs. The midwives in the communities still have to examine the pregnant women and look after them when they are ready to give birth. So these are challenges that affect the women in the community. The Ebola virus disease is doing a lot of damage to the women in this light. So one of the key ways in which the virus has affected our own local organization has been the fact that our field workers used to stay in some villages overnight to work, like the hand pump technicians, those who are constructing log bridges to link some of these villages. They used to stay in the village for 2-3 weeks. For as long as they are working in the villages in that area, they will stay there. But now they can't stay there. People are afraid to host them in those villages. And even when they host them in places that are isolated, so because they are afraid of them. And even they themselves are afraid to stay in these villages. They rather go and come from these villages, which make it most expensive for us to keep them working, doing hand pumps or log bridges in the field. It makes it more expensive for them to go into the village and come out every day to do work in these villages. And one of the key things I see as the need that will still be there when the Ebola virus disease has subsided is the idea or the issue of road network. Because right now, those who are doing the public awareness campaign can only go to places where there are roads for cars to go. So the people that are outside of these areas on the main road are not even getting the kind of interaction that the people on the main road are getting from public educators about the Ebola virus disease. When there is a sick person, you call the ambulance, they don't turn up in the city. What more about these rural villages that do not have access even to the mobile phone or whatever, and they don't have access to the road, so the sick people in there cannot get out. So the Ebola quickly spreads in villages that are remote if somebody enters there with the Ebola virus disease. And sometimes the barrier teams also cannot reach to these places, so the people have to continue to take care of their own barriers in remote villages where they are not connected by road. So post Ebola, road will still be the number one priority, as has been since the war, and then Ebola coming to make it worse. Road will still be and the health issue. There is need to train more health workers. Thank you.